My name is Sabrina, and I have had a long history dealing with depression, anxiety, and complex PTSD. I am known to be extremely bubbly and positive, but whenever I was alone, it was a completely different story. Before the ketamine treatments, everything felt like it was always cloudy, like it literally felt like just everything was gray. And then after that fourth treatment, when I went on my walk, it was like everything feels clearer and everything seems clearer. After the ketamine treatments, after those 6, I noticed a huge difference where my anxiety and thoughts were no longer at the front of my head, but they were like somewhere in the back. And, life's daily tasks were at the front. Like, I was able to be physically present and mentally present when I'm talking to people. The ketamine has really given me passion, and like for the first time in my 25 years of life, I am excited about life, and that is definitely all thanks to the ketamine. Yeah.
I'm Alexa James. I'm the CEO of NAMI Chicago, and NAMI is the National Alliance on Mental Illness. And I am committed to improving the lives of those who are impacted by mental health conditions, which is really all of us, and finding partners and community that can enhance people's lives. We're very protective of our referrals, and we have over 700 that we connect to. And so when Dr. Nandra came to us with this concept, we were just starting to hear about it, and frankly, I was very skeptical. And then I had the opportunity to go into the clinic. I had the opportunity to meet his patients. We started referring people to the ketamine clinic, and it was remarkable. The outcomes, the gratitude, the hope that it provided.
My name is Ryan Maines. I served 4 years in the Army with the 3rd Infantry Division, 3rd Brigade, 3rd Infantry Division. After leaving the Army, I worked at Woodstock Fire Rescue as a firefighter paramedic for 14 years before I pensioned off the job from my PTSD. The usual things kind of got to me. Sudden loud noises kind of spooked me. Fireworks weren't a real pleasurable experience for me. Fast forward to after having 9 or 10 years on the job as a firefighter paramedic, my symptoms started to manifest in depression and lethargy. There was an article in the Chicago Tribune about me and my struggle, and the fundraiser that I created to help the Illinois Firefighter Peer Support Group. Dr. Nandra read that and reached out to me. If I had to describe the ketamine treatment's impact on my life in 1 or 2 words, I would probably say freeing. I kind of felt like myself again. My wife even made the comment that it's good to have you back. And that felt really good, to kind of have some sense of normalcy again. I wasn't Ryan with PTSD. I was just Ryan. I was just myself, and that felt really good.
Some people have been taking meds, have been in therapy for years and years and years, and they just either aren't getting better or not better enough to the point where they feel that where they should be in their lives. Ketamine has brought people over to the light in many ways, has reduced suicidal thinking, has increased their ability to feel joy. And for some people it's an additive, and for some people it's all they need are those treatments. So we are incredibly supportive of this treatment. We think that we need to encourage more people to be less antiquated in their thinking about the way that mental health services are delivered, and be really supportive about treatment that works for some, maybe not everybody, but works for a lot of people.
My name is Angie Taylor. I am a radio personality here in Chicago. I have been suffering from anxiety, depression, PTSD OCD, ADD. I feel like I sort of have the mixed bag of everything fun that you could possibly have. And I've had that since I was as early as I can remember. There was a point where my anxiety got so bad that I was suffering from really severe panic attacks that were debilitating, that would have me hyperventilating. I felt like I was having a heart attack. I was a young mother at the time, so I was always passing out and afraid that I would pass out and my daughter would be left alone. So after the first ketamine treatment that I had, which was so comfortable, so relaxing, I almost felt like I was in a therapy session without anybody talking to me. I don't know if that makes sense, but it was soothing. The room was quiet. It was peaceful. It was like one of the most peaceful moments in my day I'd had in maybe a year. There were very subtle things that I noticed along the way. Just patience with my child, for one thing. My anxiety, a lot of it comes with a lack of patience. Like, it manifests itself in I'm not a very patient person. And so I noticed those things sort of melting away. It's just you notice that you're not reacting to every little thing in a way that you're so used to. You don't know why you're not, and it's not, but you just notice it here and there. And so that's the great part about it. You're not drugged up. You're not a different person. You're not walking around like a zombie. You're not devoid of emotion, because I still cry. I still laugh like crazy. I still have highs and lows, but they're not life-ending lows, and they're not manic highs that are ridiculous. It's just a nice, I feel like this is what life is supposed to feel like, which is crazy after so long to be like, oh, this is how normal people go on with their day. I wish I could, go to the rooftops and scream about how great this has been, because if it only would have been around earlier, it would have been so great. But it's here now, and it's changing life now, and it's a second chance. So, I'm so happy.
I'm really excited about Serenity Foundation, and this is what I admire so much about the work that Dr. Nandor is doing, is that he's a real advocate. He knows that medication alone is not what cures or completely heals a human of mental health conditions. That community, that housing, that stability, that education, all of that stuff is a part of it, and he plays a significant role. When he invited NAMI to be on the board, when he invited me to be on the board, he said, I want that perspective in this space. And I want to make sure that we have a mental health professional who is auditing us and keeping us honest and making sure that that lens has been brought to the table. So, of course, I said yes. And I also want to support fundraising so that people who need this treatment can get it. I have never referred anybody to the clinic, whether they had resources or not, that have not been accepted into his care. He already does so much charity care. So for me, it was a no-brainer to support a foundation that would continue to provide access to more and more people.